primary and association visual cortices are in the occipital lobe, posterior to the parietal and temporal lobes. The occipital lobe is the smallest of the 4 lobes of the cerebral hemisphere, making up the brain's caudal section. The lobe is located beneath the occipital bone of the skull. It sits on the tentorium cerebelli, which divides it from the cerebellum. A cerebral fissure separates the paired occipital lobes. The occipital pole refers to the posteriormost region of the occipital lobe. The occipital lobe's cerebral surface forms irregular eminences known as gyri, which are separated by depressions known as sulci. The lateral surface of the occipital lobe is composed of 3 distinct occipital sulci: the intra-occipital sulcus, the transverse occipital sulcus, and the lateral occipital sulcus. The intra-occipital sulcus extends from the parietal lobe's intraparietal sulcus. The transverse occipital sulcus traverses the brain's superolateral surface transversely and is posterior to the parieto-occipital sulcus. The lateral occipital sulcus is a horizontal sulcus that separates the lateral occipital surface into gyri. The lateral occipital sulcus splits the occipital lobe into superior and inferior gyri. It is occasionally divided into 3 occipital gyri: the superior, middle, and inferior, by the lateral occipital sulcus and transverse occipital sulcus extension. The superior and inferior gyri combine to generate the occipital pole. The occipital lobe's medial surface features a distinct calcarine sulcus or calcarine fissure. It runs from the parieto-occipital sulcus to the occipital pole. The top and lower banks of the calcarine sulcus include the primary visual cortex. Each primary visual cortex receives input from the brain's contralateral half. The calcarine sulcus separates the medial surface into the cuneus, which is the superior gyrus, and the lingual, which is the inferior gyrus. The fusiform gyrus extends from the temporal lobe below the lingual gyrus. The occipital lobe arises from the telencephalon, which develops embryologically during the 3rd week of pregnancy. The embryo is divided into 3 layers, with ectodermal stem cells developing into the brain and central nervous system. The neural plate defines the midline, while the neural tube grows to generate 3 brain vesicles. The telencephalon grows and enfolds, resulting in 2 chambers that give rise to cerebral hemispheres and lateral ventricles. At 5 months, the hemispheres take up most of the brain cavity, and the sulci and gyri emerge at 8 months. The posterior cerebral arteries, cortical branches, provide circulatory flow to the occipital lobe. The parieto-occipital artery serves the parieto-occipital sulcus and a portion of the cuneus, whereas the calcarine artery supplies most of it. The lingual gyrus artery supplies the lingual gyrus, whereas the posterior temporal artery nourishes it as well as the caudal portion of the fusiform gyrus. Because of the heterogeneity of locations served by the posterior communicating artery tributaries, occlusion of these branches can result in various neurologic impairments.